Welcome to the TCC Paramedic Preceptor Program. My name is Diane Petway, one of the full-time faculty members in the EMS division and responsible for the field internship program. I will be covering some highlights of the program in this presentation, which is a supplement to the program's Clinical Field Handbook and Preceptor Handbook. We first would like to thank you for being a preceptor for our TCC students in the paramedic program. We certainly could not do this without you all. Along with being a preceptor, there are roles and responsibilities that we require to train our students. Each student has a different type of knowledge that they come to the school with. They currently can be working as an EMTB on the field for a while. They could currently be coming as an advanced provider or even an intermediate provider. So reviewing the knowledge and the skills a student has the ability of is important when you start precepting our students. Where are these students? Are they in the beginning of the program? Or are they at the end of the program? Regardless of where they are, please remember that in the program, they do not start team leads until the end of the last semester. Also, when they do finish the paramedic program, remember they are actually considered entry-level providers. So even though we try to train them above and beyond what is required for entry level, we don't want to push them on the field or clinical environment to do things that they are not ready for or beyond what we feel they should even be doing until they're seasoned providers. Please provide the student with feedback and evaluation regarding their clinical and field performance when you have them for their shift for that day, evening, or night. It really is a critical portion of their education in the program. If at any time you are very concerned about any problems a student may be having, notify the coordinator immediately so we can address this problem. Now, for minor problems that do not need to be addressed immediately, please notate this on the back of their note where there's room for you to actually write any issues that have occurred while you're precepting the students, but also feel free to call us to notify us, or if you don't want to call, you always can email us. There are some general guidelines and instructions for training our students. Be sure that they meet the clinical field dress code. If they arrive in inappropriate dress, please send them home. They should not be arriving with graffiti on their t-shirts. They should not be coming to your shift in a scrub uniform. A lot of EMTBs or A's or I's may currently be working in the emergency room as a tech where they are wearing scrubs, but that does not mean they can wear scrubs when they're in the TCC role. They should be wearing the t-shirt polo that has our logo on it. Now, sometimes at nighttime, they may get chilly outside in the winter, or even in the daytime in the winter. They can wear a long sleeve shirt underneath their polo shirt. When your student arrives for their shift, you could give them a brief orientation as far as where are the fire exits, any type of emergency equipment they may need to get, because they're, it could be their first time that they're actually with your agency or the first time they're there in the hospital with you. For field, the student always has to be the third person on the ambulance to be in the TCC role. Now, this includes 2 in the back, and 1 driver. So you could have 1 in the back and 1 driver, and the student is then considered the second person in the back, which is the third person. At the end of each shift, there is a performance critique that you can fill out. There's actually domains in the back of the note. There's 12 of them that you will actually check whether they were satisfactory, unsatisfactory, need remediation, whatever it may be. Check what is related to that student. There's also an area where you can add narrative comments, and we do read these comments. Every clinical coordinator has to review the note, and if there's any negative or positive, we do inform the student, and we also inform the training officer there. Especially positive things, we do want you all to be aware of when you're doing a good job, because it is real important to us. Some few teaching suggestions for you all when you are training our preceptors. Please remember you were a student at one time. Sometimes we have preceptors that have been doing this a long time, and we forget that first shift we had. And you may remember preceptors that you had that could have been horrible. So remember that and try not to be one of those people. When a student comes to you, how much information should they get for their shift? Sometimes we can overwhelm them. And remember, regardless of how long, I should say, the student has been out there working as an EMTB prior to coming to you, they still do not know everything. And they still should not be getting a whole lot of information at one time to overwhelm them. As the student progresses through their training, ask them, what they're thinking. Do they feel that they did well taking care of that student? Do they feel that maybe they would have done something different when they have that same patient occurrence again? You can give them constructive criticism, and there's ways to give that. Don't be mean to them. Be kind and gentle when you're trying to do constructive criticism for them, because that is actually a learning method for the student. Reinforce information with them as far as what you learn in textbooks, your didactic knowledge, and what they're actually doing out in the field or clinical environment. We can read a textbook all the time, but taking care of a patient is not always black and white like the textbook says. Sometimes we have to do things a little bit different to accomplish the goal that we want to do for that patient. Now, this is something you all learn, preceptors learn, we all learn with time, which means experience out there. Just remember, we do not teach protocols out there in TIMS and PIMS. Okay? I know that you work on your protocols with your agency on the field environment, but please refrain from just teaching protocols. Now, if you know there's something that you could do differently, but you can't do it because you're held back because of a protocol, let them know that yes, this patient could benefit from, let's use an example out on the field, TPA. Well, you don't have TPA on the ambulance, so that's part of teaching the student what would be the best treatment at the time. Even though you can't give it on the field, it certainly would be given when they get to the emergency room if they meet criteria for certain medications. And that's another thing, medications, yes, different agencies, different hospitals carry different medicine. It comes down to that medical director, what medicine they prefer to treat that patient. So while you're given a medication, you could actually bring up, well, we could use these other two medications which do the same thing, but it just so happens this is our drug of choice for this agency. So that expands their knowledge. Now, how do you evaluate these students during their internship? Be very patient with them. I do know, I was a student one time too, that sometimes preceptors can be very impatient. So remember that sometimes it may take a few minutes or a couple of hours to digest what the student has done, or sometimes it may take a few minutes to start an IV. Now, if it's a critical type patient, and it's a new student, you should not really be asking them to perform skills that is going to take them too long. It may, be a risk for the patient. So in the beginning, let the patient do skills that you have time to perform these skills and not put them in a rush type situation. Or someone who has not started that many IVs and you want them to start an IV when you're, you know, hitting all the potholes out there and you're out in that road that's windy, they're not going to be able to do it. Or give them a patient who is actively seasoned and you want them to start an IV. That's setting them up for failure. Take time to be familiar with your student. Not everybody is a cookie cutter type student. Everybody progresses at different levels, some faster than others. Students come to us with different type of knowledge backgrounds. Some may have already been in the medical care field. Some may have never been in the medical field. They may have been an accountant and this is their first time exposed on the ambulance. That can be overwhelming for them. And again, that constructive criticism that I talked about a few minutes ago, again, let them know what they've done and what they could do to benefit the patient. And sometimes it doesn't necessarily mean the student was wrong with what they did. It just may be there may be a better way to perform that skill or a different approach to take care of that patient. If there are any problems with the student, the earlier you identify the problem and communicate to the student, the easier and less severe the corrective measures will be. Okay? Try not to wait till the end of the shift, if time permits, to let them know what they did wrong. It's that teachable moment. Just like patients, we have those teachable moments. Students are the same way. Your dress code. I covered just a little bit of it, but if you look at page 13 in your clinical field internship handbook, it will break down all the requirements for dress code. It goes into tattoos and piercings, more detail. But again, the highlight is they are not to wear scrubs. No, they are to wear the polo shirt that has the TCC lettering on that. And we do have currently a couple of different t-shirts if they're in a critical care program or the regular program. But as we move on, I don't want to get into that heavily because it could be we go to one particular shirt for everybody. So again, it's going to be the TCC polo shirt. Long pants they can wear, which is navy blue, black, or khaki. I know khaki is different for a lot of agencies. Now this is everywhere field and agency because we have a couple of agencies that do wear khaki pants. In the summertime, it gets hot. We do not have in our dress code that they may wear shorts, but if it's 100 degrees and your agency on the field, now shorts is out in the hospital environment, this is just strictly field. If your field agency allows you all to wear shorts and they are appropriate shorts, you can run that by the coordinator, and we'll just do that individually because we don't want them to wear inappropriate shorts. They all are to have a TCC picture ID on them at all times. Their uniforms should be clean. They should be well kept. Please send them home if they look like anything like you have here on the pictures here. And also sometimes body odor can be an issue. That's one of those touchy things, but please notify the coordinator if a student shows up inappropriately. Again, you as a preceptor, you can make the decision whether to send them home or not. And if you do send them home, please notify us to let us know what happened. We do have some academic counseling. You can refer to page 14 in your handbook that goes into it further. We have the ethical standards. This is of conduct, must always be observed in the clinical and field agency. At no time should a student be impolite and expressing feelings or opinions while they're in your agency. Again, you can refer to our handbook for details in academic counseling. Here in the paramedic program, the EMS program, we will not tolerate at all any type of academic misconduct. And they know this because they go through the orientation phase, that this is all covered there. Now, within our program, we have paramedic objectives, so basically goals and objectives, which is listed in more detail on page 14. The following objectives that I have listed here again are part of our program. To prepare our students as a competent entry-level provider, we provide enough education, and we actually provide above and beyond the education for them to actually enter in as entry-level paramedics. Our objective 2, the students will actually have the cognitive domain, which is the ability for the student to comprehend, apply, analyze, and evaluate information related to their role as an entry-level provider. 2 more objectives. Objective 3, this is the psychomotor domain, which is going to be when the student will demonstrate technical proficiency and all the skills that they have been taught that is necessary to become that entry-level provider. Objective 4 is the affective domain. This is when the student will demonstrate the personal behaviors consistent with professional and employer expectations as going into that entry-level provider as a paramedic. Patient care, it goes in more detail on page 17. They have their primary survey, which that has been there since EMTB. That is no different. They should be able to quickly and accurately perform a primary survey. The student should be able to start obtaining information very rapidly and accurately from the observation within the environment. Now that will come with time also, depending on the situation that they are put in. The student also will possess different type of knowledge and ability to gather appropriate information depending on what's wrong with the patient as they move through the program. As they move through the program, they get different knowledge levels of anatomy and physiology, pathology, pathophysiology, and pharmacology, so they can better gather information from the patient. Now, remember, as these students progress through the program, if they're early on in the program, do not give them the reins of taking care of a mass casualty situation or a very complicated situation. Now, when they are at the end of the program, they may still not be able to handle that situation. Try to remember how you were as an entry-level paramedic What type of situations were you able to handle? It really is no different, other than some students may be able to take care of a mass casualty situation depending on their abilities and their prior job, career that they were in. Sometimes we have combat medics. Now, they could jump right in there and handle just about anything, but that's not your common type of student out there. The student should be able to effectively organize delivery of pre-hospital patient care, and as I've said, they will actually progress as they move on. Now, these students in the paramedic program, during the entire program until the end, they actually work as a team member. They don't have to be a team lead anymore. I know that's what we've been used to for many years, but now they start their team members in the 200 levels. So they are actually working with you as a team member as they build their knowledge throughout their internship. Again, the team leader is not started until they are at the end of the semester, last semester. So when the students are filling out their clinical evaluation form, which is page 18 of the handbook, they are to use blue or black ink. That includes a preceptor. Please refrain from using purple, pink, yellow, all this ink, because it does not copy well, or it will actually deteriorate as time goes through. Part of the documentation will actually be documenting the time that the student actually arrived and they left, which is also initialed by the preceptor on the back of the form. The preceptor will initial all the rows that are on our form currently on each line as each patient. I know that if you have a really busy and you fill up the whole sheet that you have, you could put the initial on the top block, put an arrow down to the last patient they have, and initial it and draw a line where that last patient was. Most of the time that's not too much of an issue on the field. It's very seldom you have 18 to 20 patients or plus. It's usually in the emergency room. If there's not initial on that line or the arrow drawn, as I said, the student will not get any credit for that skill or team member call. So again, continuing to fill out the clinical field evaluation form. On the back of the note, there is actually a behavioral evaluation. There are 12 domains there that the preceptor will evaluate the student. The preceptor must sign and print their name and their credentials on the back of the note. Okay. If the student does not get the preceptor to sign the back of the note, they do not get credit for the shift or anything that was done during that time they were with you. Now, they can get credit for that shift if they come back to you and you sign it. Now, I know you may see a lot of students and you may forget who the student is, so that's put on the student's plate. They have been told that if you forget to get them to sign, that going back and finding a preceptor, whether it's in the field or hospital, if they cannot remember you or the skills that you performed, that preceptor has the right not to sign that note, and then the student will not get any credit at all. So what is the team lead for these students? The team lead is at the end of the program, and there is a definition that's on page 90 of the clinical field handbook. Now, I am doing this preceptor training in fall semester, and we do revise our handbooks every semester. So if the page is off, it's still going to be in that handbook. So a team lead, per definition, is someone who leads the call, provides guidance and direction for setting priorities, scene and patient assessment, and management. The team leader may not actually perform all the interventions, but may assign others to do so. So think about it when you are doing a team lead. You may not be doing skills at all. nothing. You may assign it to the other team members, or the team members will just jump in and go ahead and perform the skills. Now, the team leader does not get credit for the skills that other people perform, but they do get credit for the team lead. And when the student is in their last semester and they have completed all their clinical hours, field hours, the skills, the 30 team members, and all their didactic classes, they then will enter into the team lead role under the field internship, which they have to do 20 team leads, and they have to be successful 18 out of the 20, meaning that they were able to handle the team lead. Now remember, this is entry level, so keep that in mind. Now there's some occupational and health safety, and what I'm going to do here is pull the slides up and let you read them, and you can enjoy some music while you're doing this. Okay, now that you've read those two slides, I just want to add a few things to this. Remember, the occupational health and safety is the same as you as an employee for your employer. Even though you're the preceptor, the same thing is for the student. We just ask that you not put them in a situation that they are not ready to handle, or where there's a really high exposure possibility out there that you would never put any of your new employees in. So again, we're just asking for you to keep that in mind for the assignment. One thing I do want to add also is, if any time the student is exposed or a needle stick, there is a student form that they fill out. It's in their handbook that they have. It's in the very back of the handbook under the appendix section, and it's labeled Critical Incident Report. And this is required to be filled out, and the student does give this form to their clinical coordinator. Now, if they have a needle stick or an exposure, they are to go seek medical care the same way you would as an employee. If you get a needle stick and you're bringing the patient into the ER, please let the ER staff know that there's a needle stick involved, and the student will go through the same process, and the patient will go through the same process as you do as an employee. Now, physical conditioning here, same thing as you do as an employee. The student actually learns physical condition in their very first class, as far as how to lift boxes, as you see in this picture, how they actually lift and move patients to try to prevent any problems, back injuries or anything like that. Now, once again, I would like to thank you all so much for being a preceptor for our students. Again, they could not do it without you all. Now that you have completed the PowerPoint slides, remember to complete the 10-question quiz after listening to this video. Once you complete the 10-question quiz and submit it, I will then move it forward to the program director, who will apply to get you a 1 continuing education credit for your paramedic research. Again, thank you so much.